Hello. In this video, we will review suctioning the tracheostomy tube. Suctioning the tracheostomy tube is done to clear the tube of secretions. Here at Texas Children's Hospital, we teach caregivers how to suction the trach with an inline suction catheter as well as a standard suction catheter. Your child will need to be suctioned at least twice a day, once in the morning and once in the evening, and sometimes more frequently. You should learn your child's normal breathing pattern so you know when they are requiring suctioning. What you see, feel, and hear will tell you when to suction your child. Signs you should look for may include noisy breathing, rattling, bubbles of mucus at the trach opening, increase in respirations, and possibly increase in work of breathing. Most patients that are dependent on the ventilator will use an inline suction catheter, which is a closed suction circuit. For this type of suction, you will need the following: soap and water or antibacterial hand gel, suction tubing, suction machine, suction depth, an inline suction catheter attached to your child. Begin by washing your hands. Put on gloves if needed. Attach the suction catheter to the suction tubing and turn on the suction machine. Insert the suction catheter into the trach tube to the pre-measured length. The number should be present in the clear window furthest from your child's tracheostomy tube, as seen here. Apply suction by placing your thumb over the thumb control valve and pull the suction catheter out of the trach tube. Remember, one hand should always be on the trach tube to ensure the ventilator tubing is not disconnected. Do not suction the airway for longer than 4 to 5 seconds at a time in order to allow your child to recover. Go ahead and assess your child's breathing. Provide oxygen should your child need it, and repeat the steps if your child requires more suctioning. Feel free to suction your child's nose and mouth if needed. If you have trouble getting secretions out with an inline suction catheter, or your child does not use an inline suction catheter, you can use a standard suction catheter. For this, you will need the following equipment: soap and water or antibacterial hand gel, suction tubing, suction machine, gloves, and suction depth. Begin by washing your hands. Set up the suction catheter and suction machine. Put on gloves if needed. Attach the suction catheter to the suction tubing. Turn on the suction machine and remove any tubing attached to the tracheostomy tube. Go ahead and insert the suction catheter into the trach tube to the pre-measured length. Apply suction by placing your thumb over the thumb control valve and twirling the catheter between your thumb and forefinger as you pull the catheter out of the trach tube. Do not suction the airway for longer than 4 to 5 seconds at a time in order to allow your child to recover. Assess your child's breathing and provide oxygen should your child need it. Repeat the steps if your child requires more suctioning. Rinse the suction catheter with water if you plan on reusing the catheter, and clear the tubing by suctioning a small amount of water through it. Turn off the suction machine and clean your hands.